Opinions from suicide experts. Ronald W. Morris is a suicidologist whose career focuses on suicidal behavior and the prevention of suicide. Morris believes that there are many factors that can contribute to suicidal behavior, such as depression, marital issues, physical illnesses, and alcohol and substance abuse. According to the study Suicide and Suicidal Behavior, researchers found evidence that there are many factors that can contribute to suicidal behavior. The first factor is demographic factors, which include low grade point average, gender, age, marital status, drug and substance abuse, and a history of mental illnesses. Psychiatric factors include mood, personality, and psychotic disorders. Psychological autopsy studies reveal that 90 to 95% of the people who die by suicide had a diagnosable psychiatric disorder at the time of suicide. Many family studies have proven that suicidal behavior is biological. In some cases, hereditary mental disorders are the cause. However, the biologic factors most consistently correlated with suicidal behavior involve disruptions in the functioning of the neurotransmitter serotonin. According to the study Suicide and Suicidal Behavior, stressful life events can interact with any of the factors mentioned above and lead to suicidal behavior. Stressful life events include family issues, occupation, legal and financial problems. Chris Gilchrist is a licensed clinical social worker whose career and passion is focusing on the prevention of suicide. Gilchrist believes that the number one cause of suicide is depression. According to Gilchrist, 90% of all people who die by suicide have a diagnosable psychiatric disorder at the time of their death. The primary cause is untreated depression. Depression is a disease that is treatable. Since depression is conceived as one of the most salient risk factors for suicide, depression prevention and ensuring access to treatment are often conceptualized as key components of suicide prevention. Major depression is one of the most important risk factors for suicide. In psychological autopsy studies of unselected populations, subjects with severe unipolar depression make up 13 to 70% of all cases. Attempted suicide has been shown to be more likely when there are a higher number of depressive episodes or more time spent in depression. Furthermore, it has been concluded that once a suicide attempt has occurred, the patient is at high risk for more suicide attempts if future depressions occur.